Medical news from medRxiv. Routine implementation of α-synuclein seed amplification assays reveals high diagnostic performance and the limited value of Alzheimer disease fluid biomarkers for detecting α-synuclein co-pathology. The implementation of α-synuclein seed amplification assays in routine clinical practice has revealed a high diagnostic performance in detecting α-synuclein pathology, with significant implications for the diagnosis and management of neurodegenerative diseases. This is particularly important as α-synuclein pathology is a hallmark of Lewy body dementia, and accurate diagnosis is crucial for providing appropriate care. The study's findings also highlight the limited value of Alzheimer's disease fluid biomarkers in detecting α-synuclein co-pathology, suggesting that these biomarkers may not be sufficient for identifying concomitant α-synuclein pathology in patients with Alzheimer's disease. The diagnostic value of α-synuclein seed amplification assays in routine clinical practice has remained incompletely characterized, and the relationship between these assays and cognitive performance and fluid biomarkers is not well understood. Previous studies have shown that Alzheimer's disease cerebrospinal fluid and blood biomarkers can accurately detect amyloid and tau pathology, but their ability to identify concomitant α-synuclein pathology has been unclear. This knowledge gap has significant implications for the diagnosis and management of neurodegenerative diseases, as α-synuclein pathology is a common feature of several diseases, including Lewy body dementia and Parkinson's disease. The study included 398 patients from the multicenter memory clinic Alzheimer cohort, all of whom underwent cerebrospinal fluid and blood sampling with measurement of various biomarkers, including amyloid and tau pathology. The patients also underwent cognitive assessment using the mini-mental state examination, and clinical diagnoses were independently confirmed by 2 senior neurologists. The α-synuclein seed amplification assay was used to determine α-synuclein status, and the results showed that 19 out of 20 patients with Lewy body dementia and 32 out of 203 patients with Alzheimer's disease were positive for α-synuclein. The assay presented a sensitivity of 95% and a specificity of 93.1% for distinguishing Lewy body dementia from patients without Lewy body dementia or Alzheimer's disease. The key results of the study showed that α-synuclein positive patients had lower mini-mental state examination scores, lower cerebrospinal fluid amyloid ratios, and elevated plasma glial fibrillary acidic protein levels. However, within the Alzheimer's disease subgroup, only the cerebrospinal fluid amyloid ratio differed marginally between α-synuclein positive and α-synuclein negative patients. The study's findings suggest that α-synuclein seed amplification assays may be a valuable tool for detecting α-synuclein pathology in patients with neurodegenerative diseases, and that these assays may be more sensitive and specific than Alzheimer's disease fluid biomarkers for identifying concomitant α-synuclein pathology. The study's secondary findings showed that α-synuclein positive patients with Alzheimer's disease had similar levels of cerebrospinal fluid total tau and plasma p-tau 181 as α-synuclein negative patients, suggesting that these biomarkers may not be useful for identifying α-synuclein co-pathology in patients with Alzheimer's disease. These findings have significant implications for the diagnosis and management of neurodegenerative diseases, as they suggest that α-synuclein seed amplification assays may be a more accurate and reliable method for detecting α-synuclein pathology. The clinical significance of the study's findings is that α-synuclein seed amplification assays may be a valuable tool for diagnosing and managing neurodegenerative diseases, particularly Lewy body dementia. The study's findings suggest that these assays may be more sensitive and specific than Alzheimer's disease fluid biomarkers for identifying concomitant α-synuclein pathology, and that they may be useful for monitoring disease progression and response to treatment. However, the study's limitations, including the relatively small sample size and the lack of longitudinal follow-up, must be considered when interpreting the results. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.